So, people ask how I ended up in the technology space or the digital health space. Kind of a fun story. I mean, it started honestly at like a coffee station, like asked a simple question about why when I order X, it doesn't happen. Like, why? How could this be the case? And instead of getting an answer, instead of somebody fixing a problem, I got a meeting invite, and the meeting invite had the nurse leaders, for this particular unit, happened to be the post-anesthesia care unit, but it also had the informatics team. And so it was like my first foray into understanding that data can transform patient experiences. In this case, like the cost of the experience for the patient was an extra night's stay. Like some of these patients were not getting discharged as quickly as they could. So you start to see like, okay, like this is happening, 10 or 12 times a month. These 10 or 12 patients a month, get home and you kind of like, I got a taste for like scaling my influence. And so we fixed this problem, and then like people realized I was a nice guy and had a knack for conversation and was willing to put in the hard work. And so small problems became medium problems, became big problems, became massive scale problems. So yeah, the problems we fix now impact the 330,000 patients that get elective operations in our system in Southern California every year, and the millions of people that touch our surgical departments. So been a slippery slope. It's been a lot of fun, but the balance between my very intimate clinical practice as a surgeon, balanced with kind of the broader, maybe less deep, but very wide impact has been just really satisfying for me.